does administer the Medicare program. Something interesting on CMS, when the secretary came to the regional offices, there's 10 regional offices nationwide. It's not on?
Closer to your mouth.
Is that better?
Yeah.
Okay.
Yeah, you have to hold it all the way up.
When the Secretary Sebelius, Secretary of Health and Human Services, came to the regional offices shortly after the law passed, the ACA passed in 2010, she noticed, it's a 900 plus, almost 1,000-page law, and said many times in the law it states the Secretary shall do ... The Secretary shall ... And many times, hundreds of times, the Secretary shall ... Well, the Secretary is Secretary Sebelius, the ... is us in the regional office. So we have lots of work to do, and we are the federal agency that's going to be implementing the majority portions of the Affordable Care Act. We are working together with other federal agencies. There's the IRS involved, there's the Small Business Administration involved, but mostly, especially for Illinois, it will be the CMS, Centers for Medicare and Medicaid Services, and Illinois, because it's a partnership state, my person next to me, Brian Gorman, implementing the marketplace. But the Affordable Care Act is not just the marketplace that you're going to learn about today. It is really transforming the health insurance industry and how we receive health care. So there really is just four main pieces that we want to just make sure that you are focusing on how the health care reform law impacts you. Within each pieces, there could certainly be a whole day's worth of training on it, but just to give you an overview today, it really changes the way that health insurance plans do business. Health insurance plans used to self-select the healthiest and the people who could afford to pay the premiums and not submit too many claims. And that's the way that business functioned. That is not the way that the Affordable Care Act is going to allow the health insurance industry to practice going forward. So it really protects the consumers, making sure that it is a transparent process with the health insurance companies, and gives you quality health care that you can compare apples to apples and be an informed consumer so that you can select the best health insurance plan for your individual needs. It's also going to make healthcare more affordable. So for people who were lucky enough to have employer group health insurance through their job or maybe through their spouse's job, that was great. But more and more, that was less of a scenario of an option for people, and they would have to go buy health insurance on their own. And more often, it was out of their reach economically. So for those people who have to buy insurance on their own, they're going to see a significant decrease of those premiums and be able to have health insurance, comprehensive health insurance for their own individual needs at an affordable price. If you have Medicare or you have employer group health insurance plan, you're going to stick with Medicare, you're going to probably stick with your employer group health insurance plan. That's probably not going to change very much. It also helps the Affordable Care Act for better access to care and coordination of care. So especially for people who have chronic diseases, they would see different doctors, they would see different specialists. Dr. A didn't know what Dr. B was doing, didn't know what Dr. C was prescribing, and if you went to one emergency hospital on Monday, next month you went to another emergency hospital, there was no way of coordinating that type of care. There was duplication of services. There was redundancy of services. There were services that just weren't needed sometimes or weren't even appropriate. So the better access to care and coordination of care is a key piece of making sure that we're providing the best health care at the appropriate time, at the appropriate place for your individual needs. And then lastly, it strengthens Medicare. Not a single dollar was removed from the Medicare program. The Medicare benefits that were promised in previous years are still there and stronger and are going to be maintaining Medicare program for 8 more years because of the changes that were available through the Affordable Care Act. So we're going to focus a little bit on that information as well. There was a piece that people sometimes recognize as part of the Affordable Care Act called the Patient's Bill of Rights. That was something that was presented to the public in a concise manner to make sure that they could understand how the Affordable Care Act is going to be affecting them immediately. Starting since 2010, it denied, insurance companies could no longer deny coverage to children who had pre-existing conditions. So what would happen was, if a family was buying insurance on their own, because they didn't have employer group health plan, or maybe they were a small business, and the child was born with a cleft palate, those insurance companies could say that child had a pre-existing condition and therefore not eligible for coverage. And so obviously that doesn't make much sense in the common person's common sense. That was no longer allowed under the Affordable Care Act. That protection is going to be expanded to everyone of all ages coming in. Enrollment starts in October, and the plans will start offering those protections starting January 1st of next year. It also stopped putting a lifetime cap on the benefits that health insurance companies offered. So let me just take a condition like hemophilia. If your child was born with hemophilia, which is a genetic condition that they were just born with, you run through $1 million life insurance policy in about 3 or 4 years. Hemophilia is a very expensive condition to treat. You have blood transfusions, you have expensive medications, you have complications. So again, if a family had their own health insurance policy, maybe because they were a small business, and let's make even a husband owned a dry cleaners and the mom was a teacher, and the mom had excellent benefits through their teacher benefits, very rich teacher benefits that were, in most people's eyes, a very good plan. That plan from the mom's teacher plan could have $1 million lifetime cap. So that child would be on the mother's plan along with the husband. And when the child turned 3, they got a notice from the insurance company, you are reaching your lifetime cap. Insurance will no longer be available for your son. So she hopes and prays that she makes it to the next open enrollment period for her plan at her job, and she switches to another HMO or PPO offered by her job. 3 more years go by, she's still a teacher. She maxes out the next HMO's or PPO's life cap for her son. So again, 3 years later, she needs to select another plan offered by her employer. Well, employers don't offer hundreds of plans. Employers may offer maybe 3, 5, maybe at most maybe 10 plans. So as you can see, before that child turns 18, he has maximized his mother's teacher plan options, lifetime cap on all of those insurance options. So then they have to go to the general market and maybe buy a small individual plan, but that son could also maximize those same options a couple years down the line. So even in a common environment where you have employer benefits, those lifetime caps were really a hindrance for providing comprehensive health insurance to everyone's situation. That is no longer allowed for the Affordable Care Act. Also, another option in Illinois for insurance companies that used to take advantage was canceling your insurance when you're sick. If you put in a claim, it's time for you to renew every year, they would no longer insure you because you submitted a claim. Or if they thought that your condition was going to deteriorate in the next couple of years and you were going to submit claims in the future. Or if you decided when you were 14 to get treatment for acne and had a prescription for Accutane, and you didn't submit that prescription back when you were 14, because you didn't really think about your health care when you were 14, that was your parents, and you found out when you were 40 that you are now shopping for your own health insurance because you have your own business or you just don't have employer group health coverage, they would look through your records from the time you were born, the insurance companies, and rescind your policy, conveniently give you a check back for all the premiums that you've paid as part of a member of that plan, and say, your policy is rescinded, you lied on your application, and so it was as if you never had insurance no matter how many years you paid for your own plan. So that is no longer allowed. Insurance companies are set to a higher standard because of the Affordable Care Act and need to provide comprehensive, fair, quality health plans for everyone who is in the United States. It also makes it more affordable. Plans could set their premiums. No one was having oversight over the amount of premium increases they were doing every year or how much money of those premiums they were spending on medical care and how much money was going for administrative costs. Administrative costs being marketing or salaries of their staff, whatever it may be. So there's a requirement that they must at least spend 80 cents of the dollar on medical care, meaning providing you medical care as a health insurance company, and at a maximum 20% on administrative costs. If they do not meet that bar, then they are required to send you a check to you, or to, if you are part of a group plan, to your group's administrator, to make sure that they're meeting that 80% rule, spending on medical care. If they can't spend 80% on medical care, then maybe they shouldn't be a health insurance company, because that's what they're there to provide. It also makes it that they cannot raise your premiums by a certain amount without it being reviewed by the Secretary of Health and Human Services. So if they raise it by more than 10%, they need to justify, why are you increasing your premiums 10%? It may be legitimate. Maybe a lot of their beneficiaries were submitting high-cost claims that did not fit into what they had allocated or what they had thought that was going to come into for the entire year. But if they cannot justify an increase for more than 10%, then the Secretary has the power to tell them so. Their rates